This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Millions of babies were born during the pandemic's first 2 years. We know in 2020, especially, life in a pandemic meant parents stayed isolated, away from their extended family, and from settings like early childhood centers, and missed other social interactions like playdates. How are these toddlers faring today? Coming up Where We Live, we talk about that with a Connecticut pediatrician, and we hear from a researcher who studied infants born between March and December of 2020 to review their differences in neurodevelopment compared with babies born before the pandemic. Now, did you have a pandemic baby? What was your experience, and how is your child doing today? You can join us, 888-720-9677. That's 888-720-WNPR. You can share a comment on our Facebook page or find us on Twitter at Where We Live. Joining us first on Zoom is Sarah Laskow, who's a senior editor at The Atlantic. She wrote about what it was like to have her first child in the beginning days of that pandemic. Sarah, welcome to our show.
Hi.
So tell us about that time. It must have been scary. You know, here in Connecticut, we remember what that was like, those first days, the first wave hitting New York City and Connecticut. And so what was going through your mind? Because as your due date was approaching, this worldwide pandemic was also evolving.
Right. Well, I was very pregnant. I'm a science editor, so I was spending all of my time really editing articles about this like increasingly scary situation. And I think I started just hoping actually that the baby would come early because every day things were looking worse and worse. And so she actually did come 2 weeks early, which now that I think about it was really lucky because, you know, as we know, the COVID cases grow exponentially. And so the difference of just the danger of being in the hospital 2 weeks later would have been that much greater. And, you know, this was a time like when we drove to the hospital. I live in New York City, and I went into labor on a Saturday night, and the roads were empty. You know, there were signs flashing everywhere, like stay home. So it was a pretty apocalyptic scenario. And at the hospital, everyone was very nervous. I mean, no one really knew exactly what was going on. The doctors and staff all had masks, but this was at a time when there weren't enough masks to go around. So I wasn't wearing a mask. My husband wasn't wearing a mask. And, you know, really the whole time we were there, the sense we got from everyone around us was, you know, you want to be here as little time as you need to be. So like, you know, get the baby out, make sure that she's doing well, make sure you're doing well, and then go home and stay there.
How many hours were you in the hospital for her birth?
I think basically 2.5 days. You know, I was in labor for 24 hours, and then we were there, I think 36 hours after that. So a pretty short hospital stay. And we were lucky that, you know, everything went well and everyone was healthy afterwards.
I mentioned this was your first child, so there's a lot of expectations for couples when their baby will be born soon, and there's this you put a lot of planning into that moment. And again, COVID, all the anxieties surrounding this pandemic, you know, added to, or maybe changed, you know, what in your mind was going to be your daughter's birth story. And so now you're home. How did that, the fact this pandemic, again, was evolving, how did that change your plans to have maybe your family over to see your baby, or who was there to provide you support?
Yeah, I mean, for the most part, we were alone, which I think is different than what we were expecting. You know, I think even today we think about like how nice it would have been to have even just like a few friends over, more of our family, to just be able to like hold our baby or spend time with us in those like early, very tender days. We were lucky in that my mom lives very close by, and she was in our pod, you know, from the beginning. And so we weren't entirely alone, but having a baby, I think I understand is always very isolating. You're in this little world with this newborn who needs like constant attention. And so in some ways, like it was nice, I guess, in that like everything social that was happening on Zoom. So we still had that connection with people, but we really were mostly by ourselves for a very long time.
You can join our conversation as we talk about pandemic babies and how these toddlers are doing today. Our number, 888-720-9677, or find us on Facebook and Twitter at Where We Live. Before I take a call, you'd mentioned that you were a science editor at The Atlantic. Did you feel like you were able to enjoy your time with your baby, that you could disconnect and say, my colleagues have this, I've got to focus on my family now, considering this pandemic?
I think that I called into work more than I would have otherwise. We were having like all staff meetings every week. And so I definitely was paying more attention to work than I was planning on. But at the same, I work with incredible journalists and I did feel like, my colleagues have this, like I didn't feel like I needed to be reporting or editing or anything like that. I just wanted like everybody to like know what was going on and understand what was going on. And so our Slack was and still is like a really great resource of just really smart people trying to figure that out. So, I didn't unplug as much as I might have otherwise.
You're hearing Sarah Laskow here on Where We Live, senior editor at The Atlantic. John's calling in from Bloomfield. John, what was your family's experience with pandemic babies?
Well, my firstborn son was born March 26th. And we got to the hospital, and the rules were literally changing by the hour while we were at the hospital. We weren't sure if I was going to be able to be in the delivery room, but I was able to. All right, we'll bring you your food. Okay, well, maybe you can go to the cafeteria, but don't leave the building. There was just it was scary. It was a really scary experience in the hospital, but once we got home, it was isolating. The woman that was speaking previously expressed it almost exactly verbatim what my wife and I experienced, where we just were constantly trying to be in contact with our friends and our family, looking through the door so they could see the baby. And it was tough, but we got through it. And I have to say, my son is pretty resilient. One of the comments that I heard multiple times was, "Oh, he's afraid because everybody has masks on," and couldn't have been further from the truth. It was just that's what he knew, so it was completely normal. He didn't care at all about masks, with people having masks on. So the kids are resilient, and he's doing really well now.
Well, that's good to hear. Thank you, John, for sharing your family story with us. You can join us too, 888-720-9677, or find us on Facebook and Twitter at Where We Live. Sarah, I'm wondering if you could respond, because there was a part in your article for The Atlantic where you even talk about some of the pandemic's weird realities, of course, with people wearing masks. Even if you're isolated, all these family pictures in that first year where the mask is, featured in these pictures, and how your daughter responded. How did you see her respond?
Yeah, I think similarly, I don't think that she was freaked out or anything by masks. And I remember, probably around the time she was getting object permanence, she understood that there were people's mouths behind the mask. And she just found that like endlessly funny and fascinating. Like, oh my God, like there's a mouth there. Like everyone who's wearing a mask has a mouth. But it never like freaked her out or anything. It is just like, has been a fact of her life. She's speaking now and one of probably the first 50 words she said was masks, but it's also like, she's just very interested in clothes. She also talks about like boots and pants and coats and hats. I think it is like, to us, it's very strange. We look at these pictures of our first year of her life, and, we're wearing masks in scenarios that like now we wouldn't even wear them, because we just were so unsure about what was the right thing to do. So, even when we were like nowhere near anybody else out, if we were outside the house, we would be wearing masks. And so I think it is like, like they are strange. It's a strange time to think about. And I think like, I anticipate that she'll have questions about it one day, like what was the deal with this? What were you guys doing?
And when you think about, you'd mentioned feeling, oftentimes new parents are isolated in those first few days and months. But when we think about the support that you got, sometimes even going out to talk with other new moms with their babies, again, not being able to make, to have those interactions, Sarah, how do you think that impacted you?
Yeah, I think that is one thing we definitely missed out on. I was just at a birthday party for a friend, and one of the guests there was someone who was in her new mom's group when she had her first baby. And so, yeah, like I think we were just like, we were lucky in that we have like lots of great friends and community, where we live, but we don't really have a community of like parents who have like exact pure babies, because all of those sorts of things just weren't really on the table when our daughter was born.
When you wrote that article for The Atlantic, did you hear from a lot of readers, Sarah?
Yeah, I did. I mean, I think people, like the person who called in, anyone who went through this experience, like, has it kind of just like seared in their memory. Like, of course, it's like having a baby is a big life event, no matter when it happens. And like to have a baby at the beginning of the pandemic when so much was uncertain, I think was just like, hard to process almost. And you think about a lot, like what was that experience? And of course, like I think we all like sometimes think about like what was our beginning of the pandemic story, and like this one is just one that if it's your kid, you'll be telling forever, because that's the story of their life. That's the beginning of their life.
We'd love to hear from you, too, about your pandemic baby story, how your child or children are doing today in the first 2 years of this pandemic. Again, our number, 888-720-9677, or find us on Facebook and Twitter at Where We Live. Danielle is calling in from Coventry. Hi, Danielle.
Hi, how are you?
I'm doing well. So tell us, what was your experience?
Yeah, so I had identical twins in June of 2020. And so kind of in the thick of it there. And I also have a 15-month-old at home at the time. And so my hospital experience is, so I required a C-section. At that time, luckily, my husband was allowed to join me. But obviously I wasn't able to bring my daughter in, my older daughter. And then beyond that, the twins were quite small when they were born, so they required a week-long stay afterwards. And so I wasn't able to leave and come back. So I wasn't really anticipating a whole week-long stay. So I wasn't able to see my daughter for a full week.
I'm sorry to hear that,
Danielle. Yeah, that was really hard.
Yeah. And how are your children doing today?
Sorry, I get so emotional. They're doing really, really well. I think one of the toughest things, though, is just so my husband's family is out of state, and my family's from Canada, Calgary, Alberta, and so we aren't able to get together. I wasn't expecting to be this emotional. And so it's just been really tough getting the grandparents together and the kids, to see the kids grow up. It's already tough when people live so far away, but just the extra, restrictions have been really tough.
Yeah, I can understand why this is making you emotional. We think about how isolation impacts people, especially when you have young ones and you want to share, you want to be there for these life moments, but also share them with your family. And so I think it's important to let people know that families that had pandemic babies were going through this. And Danielle, thank you so much for sharing a little bit of your story with us. Sarah Laskow, did you want to respond to what Danielle shared with us?
Yeah, I mean, I agree with what she's saying, that like one of the hardest things about going through this experience is just like the ways it affects how, like, who you're able to share your children with, and just like the restrictions that are put on you in general. Like my my daughter has one aunt and uncle on my side and one aunt and uncle on my husband's side, and she's really only met her aunt and uncle on my husband's side once, because they were living abroad when the pandemic started and they have their own young child. So it's just been really, really hard to spend family time together. And so, it's when I think about the things that make me the most sad, it's really that, like, that, these kids like are, and these like important people in our lives, like only like have these sort of glancing moments with my daughter, and she's getting so much bigger so fast, and it's like these aren't moments that you can get back, and it's really it's a very melancholy aspect of this, that just all the parts of your life that you were hoping to share with the people who are closest to you, like you just don't get to sometimes.
I was thinking about some of the milestones with a first child, even taking them for their first haircut, and how maybe parents had to delay doing that depending on what the cases were like in their community. What challenges did you encounter, Sarah?
Yeah, so we had that exact experience. My daughter's hair was getting very long during the Omicron surge, so we waited to take her to get her first haircut until we felt a little bit more comfortable with that. Yeah, I think, just medical things, I think, have been very challenging. Like she had some extra tests that she needed at the very beginning of the pandemic, and like having to take this tiny, tiny baby to the hospital, like during the first COVID surge, like was so scary. And like my daughter goes to daycare. We were able to like delay putting her in because my mom was taking care of her. But like at a certain point we were like, well, we really want her to be around other kids. So we put her in daycare, but there's a lot of other things that I think we would have done with her that we just haven't really gotten a chance to do. Like, especially like seeing family members and things like that, that there's whole parts of our family who just haven't even met her yet. So
Sarah, why did you want to write about this part of your life? Do you feel like in this move by society to want to move on and to forget about some of the trauma and, as you mentioned, the melancholy of the last 2 years, that we want to forget about these experiences, but it's important to acknowledge them too?
Yeah, I think that's right. I think also, like, the pandemic has been so hard for so many parents. Like in some ways I think that like the experience, like I can't even imagine like what it would have been like to have a kid who's my daughter's age now when the pandemic started. Like a baby needs a lot of attention, but they're also just, they sleep and eat and cry and that's it. A toddler has like needs the world and needs people, and to be isolated with a toddler, or have a small child and then be like having like new babies on top of that, like I think that like so many people have had so much to carry just in terms of like trying to get through their normal life. And I think that's a really important part of the story. But I think like in some ways my experience has been that there's another side to that, which is just like, having a small kid who's growing up in this time, like just gives you like a very clear sense of how much time has passed. And that was what I was hoping to capture in the story. Just the idea that like, sometimes we talk about like the pandemic time as a blur, like it's still March 2020, but like the whole time, like it's felt like very clear to me how the time has been passing, because I live with this small person who's changing all the time and getting bigger and bigger and bigger. And so it's just very clear to me exactly how long this has been going on.
Well, Sarah Laskow, we appreciate the time that you've spent with us. Thank you for writing that story for The Atlantic. Sarah is senior editor at The Atlantic. We appreciate your time today.
Yeah, thanks for having me.
You're listening to Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Coming up, a local pediatrician from Connecticut Children's joins us as we continue talking about pandemic babies. We'll also hear from a researcher that studied infants born between March and December of 2020. What differences did researchers find in the baby's gross and fine motor skills compared to infants born before the pandemic? We'll find out after a short break. You can join us too, 888-720-9677, or find us on Facebook and Twitter at Where We Live. You're listening to Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Today we're focusing on how the last 2 years have impacted pandemic babies and what pediatricians are seeing today. Did you have a pandemic baby? Kathleen on Twitter shares, we adopted a newborn in August of 2020, and we're grateful to have had the extra time together at home because of work from home. But sad our niece never got to hold him as a baby, and we haven't been able to spend time with lots of out-of-town family. What's been your experience? You can join us, 888-720-9677, or find us on Facebook and Twitter at Where We Live. Joining us now on Zoom is Dr. Calab Wasser, who's a primary care physician at Connecticut Children's. Calab, welcome to our show.
Thank you for having me.
We heard from our previous guests and callers that it was, of course, a difficult time during the pandemic, especially for new parents. But I'm wondering what you observed in your doctor's office when you were able to see families in person. I'm wondering if you could share some of that with us.
Absolutely. Yes, you have some very insightful callers. And yes, I think they hit a lot of it right on the head. A lot of the concern, the delay in care that I'm sure many people, were aware of with delayed childhood immunizations, as was alluded to by others, was a fear of coming into hospitals, of coming into the office. This is where people are sick. This is where COVID lives. I don't want to expose my young children to something like that. Because of it, we really saw a significant delay in seeking appropriate or even routine care for their children.
And when when babies are first born, there are a lot of what they call well visits in the doctor's office. And so I'm wondering if you can talk about, what those experiences were like with parents, especially new parents, and what you're noticing with children as they're now, 1 and 2 years old.
I think at the beginning, there was a lot of fear. There was a lot of unknown, a lot of questions, especially not knowing the effects COVID might have on younger children. So over time, it required a lot of sort of easing parents' concerns and waiting to sort of get more data, get more of an idea of what health risks this might pose and how we can best protect these young children. Over time, we've gotten a much better sense of that, and we have greater measures in place. And I think kids are generally doing well for the most part from a health standpoint. And now, as we're coming up on, 2 years in, we're now starting to catch up on routine visits, childhood immunizations, ensuring we're monitoring developmental milestones. And the other piece that I think has been really significant over the last few months is the implementation of any services that might be needed. If, for instance, one of the more common delays you'll encounter is, an expressive language delay, the difficulty in getting the words out. And for majority of the pandemic, a lot of the services, that often were offered in the home, things like birth to 3 and early intervention programs, were switched to Zoom, as we are today, and much of our life has become. And we really saw that that was not as effective a mode of therapy for a lot of these families. And while children were progressing, not at the speed we would have hoped they would. So now here we are at a point where we are back to doing more in-home services. We are providing direct care, or I should say, the programs are providing direct care, and we're seeing a significant benefit from it.
When you talk about development, can you maybe be more specific for our listeners, maybe for those who don't have children? When we think about, how babies should be responding or what they should be doing at like 2 months and 6 months and 8 months.
Well, so we have a set of what we call developmental milestones that we monitor at each well-child visits. Children are seen at the newborn period, and then at sort of set standardized intervals, 1 month, 2 months, 4 months, 6 months, 9 months, several times over the first year and even 2 years of life. At every time, we're monitoring language development from the early stages of even just cooing and recognizing voice in a simple back and forth and imitation of sounds at young ages to, as Sarah had alluded to, her young toddler now talking and eventually actually developing words and phrases and putting together sentences as they near, closer to 2-3 years old. That's language. We also look, we monitor their fine motor skills, in terms of, as they get older, ability to sort of feed on themselves and grab different objects, transferring objects. We look at their overall motor development as they go from sort of not even able to hold up their head to holding up that big head of theirs, to then sitting on their own and pulling up and standing and eventually walking and running and climbing all over our house. And then finally, sort of a emotional developmental stage that I think had a significant impact. And that part of where that social sort of emotional development comes from is that interaction with others, which certainly was there with their parents and caregivers. But like was alluded to by many others, there was a lot of isolation over the last 2 years, and that interaction with peers, interaction with other family members hasn't been there to the same extent. So over time now we're seeing, children are very resilient, but I think there was a time where that isolation may have impacted their sort of ability to interact well at that social sort of emotional, because they hadn't had that experience. A little overwhelmed, maybe more tantrums than we would have expected, crying, looking to parents more and more difficulties with separation anxiety. But now here we are, and fortunately we're getting through, and children are now, entering back in more into daycare and into schooling, and family members are seeing each other, and that social aspect of life is coming back for all of us. We're seeing, a very positive effect that's having on children as well.
You're hearing Dr. Calab Wasser here on Where We Live, a primary care physician at Connecticut Children's, as we talk about pandemic babies and their development over the last 2 years. My next guest co-authored a study published in the JAMA Pediatrics looking at developmental differences between pandemic babies and infants born before 2020. On Zoom with us, Dr. Lauren Shuffrey, who's Associate Research Scientist at Columbia University Medical Center. Lauren, welcome to our show.
Thank you so much for having me.
Tell us more about your study and what you were looking at specifically related to infants born between March and December of 2020.
Definitely. So we started an initiative at Columbia called the COVID-19 Mother Babies Outcome Study. And this is co-led by Dr. Danny Demetrio, who's a pediatrician, and Dr. Catherine Monk, who is a clinical psychologist who really specializes in the perinatal period and working with mothers. So when this study initially launched, we were actually interested in looking at the effects of prenatal maternal SARS-CoV-2 infection on infant development. And we were interested in this because we know that infection during pregnancy from other studies has been associated with increased risk of adverse developmental outcomes. So things like global developmental delay or specific neurodevelopmental disorders. So what we did was compared babies who in utero were exposed to maternal COVID versus those who were not on a developmental screening tool at 6 months of age. And this screening tool is called the Ages and Stages Questionnaire. And Calab has probably used this in his own practice. It's really commonly used by pediatricians. And it essentially is just a parental report measure where parents can answer questions about their children's own development in a few different domains. So we're assessing things like communication, gross and fine motor skills, problem solving, and personal social ability. So some example questions for this, for communication, would be, does your baby make sounds like da, ga, ka, ba? Does your baby make high-pitched squeals? Does your baby make grunting sounds? And parents can fill this out in about 10 minutes. And for each question, they can indicate if a skill is present. So if the baby does make high-pitched squeals, they would indicate yes. And then we also try to understand if a skill is emerging, where they would indicate sometimes or not present yet. So when we compare...
Lauren, could you summarize some of the findings, just in the interest of time?
So what happened was when we compared babies born during the pandemic to those before the pandemic, that's where we actually saw differences. So we didn't see differences in babies who were exposed to COVID during pregnancy, but instead we found that babies born during the pandemic had slightly lower scores on gross motor, fine motor, and personal social development.
Okay, that's interesting. And so when we think about the findings, I'm wondering if you can talk about, also some of the factors, related to that.
Yeah, so within this particular study, we weren't able to look at factors like prenatal maternal stress or depression or anxiety or social isolation. It really was just a group comparison between babies who were born during the pandemic to babies who were born prior to the onset of the pandemic. But based on our findings, where we saw babies who were in utero during the first trimester, were during the peak of the pandemic, had the greatest differences compared to the historical control cohort. We think that these findings might be related to increased levels of maternal stress.
Okay. And so when we think about these early findings, the need for long-term monitoring of these children born during the pandemic, Lauren.
Exactly. So this was a really early time point. These kids were only 6 months old at this particular assessment included in the JAMA pediatric study, but it will be very important to continue to follow these kids to understand how they're developing, as kids are hitting 2 now. My own pandemic baby just turned 2 on Sunday.
Oh, that's interesting to hear, again, your perspective as a researcher, but you're also living this, Lauren. Calab is still here from Connecticut Children's. I wonder if you can respond to Lauren, her colleagues' findings and how you see some of that playing out when we think about even parental stress and having to manage a lot while also, having an infant at home. Calab.
Absolutely. I find that very interesting that. And now I understand we're looking at a younger age, but many of us were all, focused on the effects the masks have. Children couldn't see faces. How would they learn to talk and reciprocate with their language? And certainly makes sense to me, and it seems fitting that you would see some delays in sort of the social emotional, but to see that it was in gross and fine motor is interesting, and it makes you wonder, like you sort of alluded to, was it more of a prenatal exposure, whether it's to stress hormone, infection itself, likely more hormonal, that was causing this. And over time, as these children get older and other milestones become greater depth to them, such as their language development, what effect that you may see as they get older. So I find that fascinating. I'm excited to see what future sort of updates you guys will have on that.
Mm. When you think about these findings and also what you're observing with your patients, Caleb, have screenings changed that, talk or figure out like what's going on in the home, the stress that, caregivers have and how that impacts the child and ways to help?
I don't think they've changed, but I think it's become more apparent. We're all very aware that there's a high level of anxiety. There always is a high level of anxiety in any with any newborn, and certainly first-time parents, first-time small families like that, and lots of questions, lots of concerns, and add on, overall global health risks and isolation, where that anxiety only increases. That sort of isolation just allows you to wander more, consider more and worry more. These things become even more impactful on your life. And I think the stress and the anxiety levels in new parents was quite high. Rates of things, postpartum depression, postpartum anxiety were very significant. And, as we touched on earlier, that fear, I think, really drove people not to seek support for those concerns for quite some time, which was almost as, if not more, concerning.
Dr. Lauren Shuffrey, I wanted to go back to you before we head to the break. These findings are interesting. Again, they are early findings. And, what's your focus today as the pandemic continues and as these children age?
Yeah, so we're continuing to follow this cohort. The oldest kids are now about 2 years of age, and we are assessing them through telehealth. So it's been really hard to bring kids in due to all the different waves of the pandemic. So we are assessing language and other different domains through telehealth in a more standardized observational way. So as I mentioned before, in this particular study at 6 months, we assess children through parental report. So I think it will be really important to objectively have psychologists and other developmental experts assess children through their own lens. And yeah, we're going to continue following this cohort as they get older. We really think that at 6 months, there's a lot more variability in things like motor development. And since babies aren't talking yet at 6 months, they're really just starting to make sounds and noises. It may be that as children get older, these other domains will become more important to understand.
That's Dr. Lauren Shuffrey, Associate Research Scientist at Columbia University Medical Center. We'll link to the study that you co-authored at our website, ctpublic.org/where we live. Lauren, thank you for your time, and thank you for sharing about your pandemic baby as well.
Thank you.
Also with us, Dr. Calab Wasser, primary care physician at Connecticut Children's. Caleb, thank you for your time today.
Thank you.
You're listening to Where We Live. Coming up, the number of couples having children was already on the decline before the pandemic. However, the last 2 years affected family planning. More after a short break. You can join us too. Find us on Facebook and Twitter at Where We Live. You're listening to Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. So how has the pandemic impacted family planning? Even before 2020, fertility rates nationwide were at a record low, according to the U.S. Census. People assumed there'd be a baby boom in the pandemic, but the census reported data pointing toward a significant drop in fertility related to the pandemic, at least in those early months, both in the U.S. and globally. And a Pew Research Center survey in November found a rising share of U.S. adults who are not already parents say they're unlikely to ever have children, and the reasons vary. Joining us now on Zoom is Claudia Geist, who's Associate Professor of Sociology and Gender Studies at the University of Utah. Claudia, welcome to our show.
Good morning. Thank you for having me.
We're interested in your research and how you're seeing attitudes towards pregnancy and forming families changing during this time.
Mm-hmm. Yeah, what we did is we had an ongoing cohort study where we followed people starting in 2015, 2016 to just see how attitudes towards pregnancy and people's contraceptive behavior and plans for family formation changed over time. And when the pandemic happened, we took the opportunity to follow up with a small sample to just see and check in how people were doing. And for many people, this was a scary time, and in line with the national and international findings, people really felt like this was not a great time to have children. For many of them, they really did never want to have children, and attitudes, especially the idea of getting pregnant anytime soon, was just seen very negatively.
Mm. And then I mentioned, in the early months of the pandemic, that anxiety was high. There was a lot of that was unknown. And then as the months kept going, we were in 2021. How has the data changed in terms of are some of these births now rising?
Yeah, it's still a little early to see how much the springing back of fertility is really happening, because in a sense, though the days are not as dark as they were in the early pandemic, there is still a lot of uncertainty going on. And what we have seen over the course of this entire pandemic is that parents are not very well supported. Oftentimes, schools and daycares were the first to close down, the last to open back up. And that has sent a signal that parents oftentimes are on their own, and especially people who cannot work remotely, for them it's been really difficult to combine parenthood and working for pay outside of the home. And I think that may take a while for people to just get back from that, because it's been a stark reminder of how difficult it is to be a parent, and it has made parenthood a little less attractive.
Mm. When you talk about this cohort, can you tell us more in terms of their demographic? And did you find that it was, younger people, Gen Z or millennials, who are less likely to want to start a family?
Mm-hmm. Yeah, so we had a relatively young sample, many people in their mid-20s when they joined our study. And this was I would say, a rather not a well-educated cohort, just sort of middle of the road, but they were smart in the sense that we recruited them at family planning centers when they initially sought contraception. So these are people who knew how to access healthcare, even though many of them did not initially have insurance. Through our study, they had access to contraception in 2015. And so we started out with people who had very clear plans and wanted to do family planning. But what we found is that even when we take into account people's age, their economic circumstances, the early pandemic really put a damper on things, where when we asked people how they would feel about becoming pregnant in the next month or so, that really was, people really said that was a very bad thing that would happen. And especially the proportion of people who never wanted to have a pregnancy really rose to unprecedented levels. And this is a sample where people were not super eager to have children, but this is a study out of a context that is particularly, family friendly. In Utah, fertility rates are still high. There's more social pressure to have children earlier compared to the rest of the country. And we also found that people were concerned about accessing healthcare, especially in the early pandemic. Some of the pregnancy checkups you cannot easily do through a Zoom doctor's visit.
Right. We heard that earlier from the doctor that joined. When we think about just panning out, because, so much of our lives, right, has been focused on the pandemic in the last 2 years, and it feels much longer. But when you compare this to other turbulent times in history, is this expected that you see a dip in, fertility and family planning? Because with uncertainty, people don't maybe want to bring a life into this world when there's so much unknown.
Yeah, you're absolutely right. I mean, this really lines up pretty well from what we know from the, the Spanish flu. There's some evidence about, dip in fertility during the Spanish flu, but also, big upheaval events like times of war, or even like positive big upheavals like the German reunification of East and West Germany in the early 1990s. There was a temporary dip in fertility because people just didn't know what was going on. And the combination of not knowing what's going on and economic, upheaval, where especially here in the pandemic, lots of people lost their jobs or things just change. Change often results in people just waiting a little bit longer, taking fewer risks, and entering parenthood. It's a big risk, including a financial risk.
Right. I had mentioned earlier that a lot of people thought that with the pandemic and more people at home, there would be a baby boom. In your research, again, as we're starting into the third year of the pandemic, do you expect there to be a bounce back?
I've been thinking about that a lot. And initially people thought, well, if all those couples are both working from home, who knows what will happen? Maybe there will be a baby boom. But I think especially initially, people were just too stressed out to really think about planning pregnancies. And I do think to some extent there will be a bounce back because people have postponed big life events. And at some point, people just don't want to wait anymore. And though the pandemic is, sort of ongoing, people may just sort of lose their sensitivity to the scariness of it all. And so a bounce back will happen, but my speculation is that it will not be a rapid bounce back, because what we have also seen is that the cost of childcare has risen quite a bit. And the cost of children is something that we can just not ignore. And so people who especially have been successful in planning pregnancies, they may really think twice about whether and when they will have a baby or another baby, because making sure that there is childcare available, like that can be a really big issue, especially in the cities.
Right. All important points. Thank you so much for talking about your research and the perspectives you bring to this conversation. Claudia Geist, again, Associate Professor of Sociology and Gender Studies at the University of Utah. Thank you, Claudia.
Thank you.
I'm Lucy Nalpathanchel. Tess Terrible produced today's show. Kat Pastor is our technical director. We'll be back tomorrow.